According to Caregiving in the United States, more than 65 million people spend an average of 20 hours per week providing care for a chronically ill, disabled, or aged family member. The specialists at Better at Home Mederi Caretenders explain the important role they play in caregiving and caregiver support.
There are some very good caregivers out there that are very proactive and are advocating for the best care possible, and I admire them, but there are also some out there that are afraid of cost, or maybe mom is viewed as a hypochondriac, maybe there really isn't anything wrong with her. It's tough to be in that spot because I would hope that when it came to my parents, I would think from a clinical standpoint, even though I'm not clinical, to make sure I'm getting her the best care possible, because I don't want to do anything that's outside of my realm or outside of my depth, because I want them here as long as possible. I think a lot of caregivers don't think like that, and they probably should. Medicare covers the cost of home health. It's intermittent care. The cost to the caregiver who is wanting to step in and be that nurse when it's outside of their realm is resenting their loved one for having to take care of that, for giving up their time. And with home health, they're going to be able to have that covered and have life and be able to get out. When you have a caregiver in the home 24/7 to where all they're doing is catering to the needs of their loved one, they're going to get depressed and they're going to lose touch with society and what's going on in the real world. And you want your last moments, your last memories of your loved one to be positive ones and not full of resentment and regret. A lot of these seniors have relocated from up north and their children are still there. We have ran into this from physicians' offices and hospitals to where mom had a heart attack, the kids came down, how am I going to take care of her? I'm 3,000 miles away. We have educated the daughter or the son on this is what our services are, this is what your mom or dad will be receiving on a weekly basis from our agency, and here's our number. If you ever want to check in and find out what's going on, as long as your mother or father say it's okay and we can discuss their health with you, we can let you know. We were out there today, her blood pressure was this is what we're seeing, this is a plan that we've put together. If there's anything that comes up, you will be the first one that we call after their physician. And that's reassuring to them. They understand that they're not just being sent home, by themselves. They still have professionals coming in, taking care of them, and they can call us any time of day. Our number is on and there's a live person 24/7 that they can reach at any time.
Here are a few tips to help you stay healthy as a care provider. Recognize the warning signs of stress. If you are irritable or exhausted all the time, you're under too much stress. Change the things you can. Identify the sources of stress and focus on what you can control. Accept help. Allow family and friends to run errands or give you a break. Seek support. Maintaining a strong support system is key in managing stress. See your doctor. Studies have shown that caregivers are more likely to have chronic illness and rate their health as fair or poor. For more information on the services offered by Better at Home Mederi Caretenders, follow the Caregiver Support Story link icon on our homepage, yourhometownhealth.com.